This webinar takes place on Ndakina, which translates to our homelands that is now called New Hampshire and Vermont. Ndakina is the unceded traditional ancestral homelands and waterways of the Pennacook, Abenaki, and Wabanaki peoples, past and present. We acknowledge and honor with gratitude the land, water, air, flora, and fauna, and the human beings who have stewarded Ndakina throughout the generations for over 12,000 years. Tonight, moderating our webinar and moderating the Q&A will be Dr. Cecilia Sorensen. She is a member of New Hampshire Healthcare Workers for Climate Action Board of Directors, and she will be introducing our speaker for tonight. So Cecilia, I will pass it over to you.
Thank you so much, Emily, and thank you in particular for speaking the land acknowledgement, which I always feel provides such an important context for any discussions of climate change and its impact on planetary health, including the health of we as human beings. So thank you so much for that. I want to add my welcome to everyone, to Emily's, to everyone, and thank you, as Emily said, for joining us on what is a really beautiful, special fall evening at the height of the color season in New Hampshire. We appreciate each and all of you from taking time to really focus on these issues so that hopefully we can continue to celebrate many more beautiful days on this planet. My name is Cecilia Sorensen. As Emily said, I'm a pain medicine and addiction medicine physician. I'm very pleased to serve on the board of New Hampshire Healthcare Workers for Climate Action and also on the Alliance for Climate and Health at Dartmouth and as Education Director at Project ECHO at Dartmouth Health. So I'll be introducing our speaker and facilitating discussion after she speaks. Tonight, Dr. Cecilia Sorensen will be speaking to us about training healthcare professionals for 1.5 degrees and beyond. She plans to speak, I think, for about 40 or 45 minutes, and we hope to have at least 15 to 20 minutes for discussion and then end right at 7 p.m. out of respect for everyone's time and evenings at home. While Dr. Sorensen is speaking, please feel free to put comments or questions in the chat at any time. When she's finished, we'll ask you to unmute and ask your question or make your comment, but you can put the right in the chat at any time, or you can raise your virtual hand when it comes time for questions and discussions. So I think that's all for housekeeping. It is a true pleasure to introduce Dr. Cecilia Sorensen. Dr. Sorensen is an emergency medicine physician. She's associate professor of emergency medicine at Columbia Irving Medical Center. She's an associate professor of environmental health sciences at Mailman School of Public Health at Columbia University, and she is director of the Global Consortium on Climate and Health Education at Columbia University, which I think many people on this call recognize as a very vibrant group that offers diverse training opportunities around climate and health and related topics. Dr. Sorensen has extensive training and credentials related to climate and health, just to name a few. Following her emergency medicine residency, she completed a 2-year fellowship in climate change and human health policy with the National Institute of Environmental Health Services. She serves on the working group for the National Academy of Medicine's Climate and Human Health Initiative. She is an author for the U.S. 4th National Climate Assessment and a technical advisor for Lancet Climate and Health U.S. Policy Brief, and she's co-editor of the textbook Climate Change and Human Health from Science to Practice. A focus of her work, which I think is really critical, is how policies and clinical actions and education around climate change and health can build resilience, particularly in vulnerable communities. So thank you, Dr. Sorensen, for joining us. We really appreciate your time and the effort that you put into all this work.
Thank you so much. It's really such a pleasure to be here. Thank you for that beautiful land acknowledgement and for the introduction. I have such fond memories of New Hampshire, so I'm sort of vicariously living through you all right now and thinking about the foliage. I had a really exciting adventure there once on Franconia Ridge Trail. So yeah, just love the White Mountains, love New Hampshire. So it's really a pleasure to join you all today. So I am going to talk, about and really open a conversation, a discussion around how we can think about training our health workforce for the realities which we are facing, right? 1.5 degrees and potentially beyond later this century. So I look forward to a robust conversation, discussion around this. I know your group has been doing a tremendous amount of work at Dartmouth, at University of New Hampshire, and beyond around education and capacity building. So really here to sort of share the work that we're doing at the Global Consortium and think about how we can synergize our work. So just to kind of start framing this is nothing that I need to really tell anybody here about, but I think that the message that we have right now around climate change and health, which is that climate change is a code red for humanity, and that language that was used by our UN Secretary General really is speaking to this health emergency that underlies climate change. And just in the past 5 years, I've seen this almost exponential engagement from health professionals around climate and health. So we are really in the right place at the right time right now to be embarking on this work. Some of the findings from the IPCC report, I also sort of want to start out by using as a framing. I think this finding is really relevant to capacity building, which is that the severity of climate-related health risks is highly dependent on how well health systems can prepare people, right? So, we know that we're going to be facing increasing storms, wildfires, droughts, et cetera, et cetera. We know that the most vulnerable are harmed first and they're harmed worst. And what stands between those harms and those people is often the health system, right? And what we are able to do to serve as a buffer between these exposures and between vulnerable patients who we deal with. So we really are on the front lines of this in so many ways. I recently, was thinking about, we want to train health professionals to be able to do this. What's that going to take? And so I went to the WHO website and they actually will tell you, I added up all the numbers from all the countries that report. There's something like 50 million, and this is just doctors, nurses, dentists, and pharmacists, 50 million health workers. I mean, that is like the biggest army I can think of, right? And so if you sort of think about all of us sort of coming together around this and being able to incorporate a climate and planetary health lens into the work that we do, our ability to have impact is literally enormous. So, I think there's been a growing trend in recognition of this around, within health professions around the world. So this was a study by Kocher et al., which was published in Lancet Planetary Health. It was a large multinational survey of health professionals. And what they reported is, basically that most health professionals actually feel that climate change is already affecting their communities across a broad range of impact categories. And they also feel a responsibility, right? We are sensing that many health professionals feel like, this is something that I need to be responding to. And what this article then went on to do was to explain, well, what are the barriers to that? And what they found was that, despite these high levels of reported commitment and responsibility, there's many challenges. And one of the main challenges was education, was the fact that many felt that they just don't have the knowledge, they don't know what to do and what they need to know to do what they need to do, right? And so for that, for this sort of to get at that gap, the Global Consortium on Climate and Health Education was formed. It was actually formed in 2017 out of the COP15 in Paris. And our mission is to ensure that 100% of health professionals globally really have the knowledge and skills to recognize, respond to, and prevent climate-related health impacts. So what we do is we organize, we empower, and we really try to amplify the voice of health professionals and organizations working in this space to convey how climate change is harming our health and how solutions are going to improve it. So our sort of general way that we function is that we engage health training institutions and obtain pledges from the head of school or the dean to educate their students on the health impacts of climate change. We bring together member institutions to create and share best scientific and educational practices. So we all sort of have a little bit of guidance, of a North Star in terms of really what do we need to equip health professionals to be able to do. And then we try to develop resources, right? We try to get everybody as resources as they can to do it. And then we really focus on training existing health professionals as well as students. So right now, this is a little bit outdated. We actually have over 300 members of the consortium in about 56 different countries. And so we're very much growing rapidly and kind of, as you can see from this map, kind of are all over the globe in many parts of the world where there's just been this kind of like wake up among health professionals sort of thinking about these issues, which I always find to be very encouraging to know that there's, like-minded folks probably meeting just like we are right now somewhere in Australia, right, or somewhere in Southeast Asia. So I think this is a movement that is rapidly multiplying. We also work with many NGO partners as well as government partners and health association partners on program development as well as implementation. So I want to give you just a little bit of an overview of some of the initiatives that we have going on, and then kind of lead that into a discussion. So as I mentioned, one of our core functions, we produce and iterate a list of core competencies for all health professionals as it relates to their roles and responsibilities in addressing the climate crisis. Our sense is that the things that we need health professionals to do are not necessarily within their traditional skill set, but it is competencies and actions which they are well equipped and well suited for. And so our competencies really cover climate and health knowledge and analytic skills, aspects of how that relates to public health practice, clinical practice. We have competencies around policy aspects of climate and health, as well as climate and health communication. And so all these competencies are accessible on our website. The way we create them is that we have a coordinating committee, which is interdisciplinary and multinational, which comes together, creates a draft, and then we send it out for basically peer review among our entire consortium, and we get feedback and we iterate it. So we're currently actually undergoing our third update, which will hopefully be launched before the new year. So, as we are sort of thinking about these kinds of roles and responsibilities, I think that it's really important to kind of define, what are we going after, and what is it exactly that we need to do, and how can we act, and how can we be most effective? So one way I think is maybe useful to think about this is, where do we plug in as it relates to primary prevention, to secondary prevention, and to tertiary prevention? I'll just give you an example of that. So for example, if we're just sort of thinking about, primary prevention, where, the real role of primary prevention is climate mitigation, right? It's preventing future harms by reducing greenhouse gas emissions from the health sector and from our entire society. And so here, I think that, public health professionals and clinical professionals, and that includes, anyone who's near patients, right? So nurses, doctors, pharmacists, dentists, allied health professionals, when we're thinking about our roles, I would say, we need to be thinking about, for public health, how do we build the evidence base, right, to understand the interactions between climate change and population health, right? We know that impacts happen, but we don't actually have the total knowledge or understanding of where these impacts are going to happen and what are going to be the health outcomes. I think the role of clinical professionals here is really to build the evidence base to understand interactions between climate change and clinical practice, right? How is this affecting the complaints that patients are coming into clinics for? And how do we trace climate issues to disease processes, which would then impact, treatment plans? Together, we have a lot of work to do as well. We really need to be thinking about how do you bring together the voice of all health professionals to articulate the need to rapidly decarbonize the health sector, as well as relaying the really positive health co-benefits that occur from health sector decarbonization. And so, just going back here real quick, so if this is the role that we want our health professionals to play, we need to be kind of working from this to equip through education health professionals to be able to perform these types of roles. When it comes to secondary prevention, we're thinking, once, the cat's out of the bag, right? We know climate change is happening. We know it's impacting communities. So how do you diagnose and address problems early before they become, emergencies? And so here, thinking about public health professionals, their role is really, performing health impact assessments, doing vulnerability mapping, developing surveillance systems, developing early warning systems as it relates to climate and health emergencies or potential outbreaks, right? And so these are skill sets that sometimes are taught to public health professionals, but oftentimes not in an explicit manner. And so these are things that can be incorporated into the training of student as well as existing professionals. When we think about clinical professionals, what our role here is, thinking about how we create, update, and adapt health guidance and treatment plans for patients, right? What do we tell our patients when there's a really bad air quality day or when there's going to be a heat wave? We need to be able to assimilate, what the best practices are for how to counsel patients, how to prepare our health systems, et cetera, right? And so that is our role, because we are those intrinsic members of this system that takes care of health. And for secondary prevention, it's going to take all of our voices and all of our efforts to think about how we use our skills to reduce health disparities. How do we really become that effective buffer between exposures and resulting health impacts? Because that's the spot where I think we need to focus a large majority of our energy on when it comes to secondary prevention. And of course, there's tertiary prevention, right? And sort of in that model, tertiary prevention is like, okay, there's a heat wave, it's happening now, or there is a massive flood and we are dealing with vector-borne disease outbreaks. I would say that the way the US healthcare system is structured right now is that we spend 90% of our resources dealing with tertiary prevention, right? We just wait till there's an emergency and then we kind of come in and try to clean up. Which is actually the most cost ineffective way to manage any type of public health crisis. And public health folks will tell you that all the time. We do need to do tertiary prevention, but we need to really be focusing on the first two levels. Regardless, when it comes to tertiary prevention, public health professionals are really, they're in the field, they're on the ground, and they're mobilizing partnerships to identify and solve health problems, to investigate hazards that are happening in the community. We really need our frontline epidemiologists and our local public health departments to be able to respond to emergencies that are happening near them. And to respond, they need to be able to detect them, right? So there's a lot of capacity that needs to be built there. Our clinical professionals, we need to be thinking about, disaster management. We need to be thinking about how we protect and care for vulnerable and affected individuals. And together, we need to be thinking about how do we establish best practices to coordinate responses to compound disasters. Just as an example of this, we can think about the Pacific Northwest heat wave and think about, we had this horrible heat episode, which lasted over a week. And then on the heels of that was this massive outbreak of wildfires, right? So you had the heat exposure followed by this sort of compound disaster where you had really, really poor air quality in the area. And so, dealing with such complex emergencies where you have healthcare systems who are overwhelmed by many sick patients and simultaneously trying to put out public health warnings, we really need to be thinking about how we work in that interdisciplinary space. And so, a lot of the work that we are trying to do is to bring together health professionals from different backgrounds to be able to share that space, to be able to collaborate, to be able to coordinate, so we have more effective actions and responses. So just to give you some examples of some of the work that we've been doing, just this past spring, we partnered with the Association of Schools and Programs for Public Health, which is sort of the parent organization of all schools of public health in North America. And we worked with them to build a toolkit for how to integrate climate and health into public health training schools. And what this toolkit consists of is really like a roadmap and step-by-step guidance for how to integrate climate and health competencies into core curriculum for all public health trainees. We give examples of, a framework for how to build a concentration in climate and health. Right now, there's only about 10 schools out of hundreds who actually have a concentration in climate and health. And then we provide a framework for how to build a climate and health course. And just to kind of give you a little bit of an example of how we present this is, we took the competencies from the GCCHE and we said, okay, here these are. And then we dissected the CEAP competencies, which are the Credentialing Education for Public Health competencies. And we kind of overlapped them, right? We did this crosswalk where we then identified common focus, skills and coursework to really see, okay, where's their overlap and how can schools not have to reinvent the wheel? This doesn't have to be this huge build, but how can you take what you have and give it like an upgrade, like a software upgrade where you're incorporating climate and health? And so this was, really a tremendous collaboration that was just launched at the last annual meeting. We also provide guidance on how to build a concentration in climate and health. Our sort of framework for this is that we need all public health professionals to have some baseline understanding of climate and health and at least know who to call and recognize that they're dealing with a climate and health related issue. But then we also need, so we need the generalists, we need everybody to sort of have a baseline understanding, but then we also are going to need some specialists. We're going to need the people who are going to be leading the charge on this from the public health perspective. And so to do that, we have to train them. And so we put together, a step-by-step guide for how to create a concentration in a master's of public health curriculum to be able to really create those types of experts. And so these are just some pretty diagrams of really what it would take to get schools up to speed with that. And we provide sort of a 2-year concentration roadmap that really kind of sketches out, here's how you do this. And so this is really a how-to guide. And the last thing that we present in the toolkit is, many schools we find actually just don't have the faculty to be able to teach this. It's a huge gap. And so oftentimes the kind of the lowest hanging fruit here is to have a climate and health course. And so we provide a framework as well for how to set something like that up. So anyway, this is a great toolkit and anyone is welcome to use it. I think that there are some kind of lessons learned from building this toolkit that could apply to sort of how do we create these types of guidelines, for example, for nursing schools, for medical schools, for pharmacy schools. How do you take existing competencies that health professionals need to know, and how do you infuse really a climate lens with that? So this work has been carried over really to the international spectrum, and the Association of Schools and Programs of Public Health in the European region is also using this toolkit and using the competencies to, again, kind of think about how to embed this type of knowledge and skills within all schools of public health. In terms of future directions, we have been working with the AAMC to think about how to build guidance documents for medical schools. They are now have the GCCHE core competencies on their website. So they've, sort of passively endorsed them, which I think is a really wonderful first step. I think we also need to be thinking about how we work with the ACGME and other specialty and subspecialty societies to build similar guidance documents and toolkits, for example, for resident and professional education. And this is sort of the list of health specialties that we need to be thinking about. How can we kind of band together and work together and have a shared kind of model with those who are running these health professional training societies to be able to fill these gaps. So I think this work has really been focusing on sort of the undergraduate, or rather the graduate health education. But it's the practicing professionals, I think, where some of our largest gaps need to be filled. My experience has been that students are by far like the driver behind climate and health education, at least in sort of undergraduate and graduate realms. They're really pushing for it. And what is often the rate limiting step at many institutions is a lack of faculty who feel comfortable enough to be able to teach material. So this past spring, we said, okay, well, let's figure this out. Let's build some capacity. And so we got together many different partners and we ran 3 different courses. The first one was in North America. We worked with Health Canada, we worked with Project ECHO, we worked with NOAA, and we had a CME, or also we provided nursing credits and public health credits. It was a 16-hour course that came with a certificate, which was a tremendous success. We had over 1,200 people taking that course. Then we ran a course in the Caribbean region with the Caribbean Institute of Meteorology and Hydrology, Earth Medic, Earth Nurse, trained about 700 health professionals there, and then worked with the Pan American Health Organization and the Inter-American Institute for Global Change Research in Latin America. This was a course that was run entirely in Spanish. Again, just trying to engage those who are interested, the coalition of the willing, to feel like they had the knowledge and expertise to really be able to incorporate this either into their work and their professional practice or into their roles as educators. So, we trained 5,000 health professionals and gave 5,000 certificates out just in 3 months. So, just an example of, how when we kind of work together and start identifying and designing interventions around these gaps, which we know exist, that I think that there's going to be some very good response. And I think this really echoes the study by Kocher et al., which shows that health professionals do want to know what to do, right? So I think that all this is very encouraging. I want to skip really quickly to some of the work that we're doing with a group called TIFANET. So TIFANET is a global organization that trains frontline epidemiologists, right? And it is currently in about 76 different countries, and generally sits within ministries of health. and often has a university partner to this. And they train really, the folks that end up going on to serve within like the CDCs or the ministries of health of whatever country that is. And Tifinet came to us and they said, we have no climate and health anywhere in our training, which is, it's kind of hard for people like us to believe that, but it hadn't been incorporated. There wasn't really a ringleader who's kind of pushing it forward. So we've been working with them. We developed a task force and a working group around this. And we now have a webinar series that is the fourth Wednesday of every month for the Tifinet community, where we're trying to sort of build education, sensitize the community, and try to bring examples of work that's already going on within the Tifinet network to the forefront as examples, and work with countries to be able to incorporate this into their frontline field epidemiology training programs, because this is just such an important part of a country's national, even regional or local response to climate and health related issues. We are working also with Healthcare Without Harm. We have a grand round standing lecture series where we are bringing kind of the voices of health professionals who are really leading the charge on health system decarbonization and resilience, and having really great robust discussions around how we can multiply and collaborate around these types of efforts. We have a learning collaborative also, which anyone from this group who is interested in education is absolutely welcome to join. We meet about every 2 months and generally invite 2 schools from around the world to kind of come and be the presenters, where they present on the curriculum, they present on what they're doing. We have a discussion around, obstacles and challenges, and, really get into the nitty gritty, how do you get funding for this? And, all those things that really affect faculty and people sitting in training institutions who are trying to get this work done, but really maybe be the only people at their institution. So this is a really great collaborative that is very supportive. So we're trying to kind of create and hold space for these types of initiatives. If any of you are involved in research, we also have 2 calls for papers out right now. Our goal with this is really to try to increase, the evidence base and the peer-reviewed literature on climate and health education as it relates to health professionals. So as I mentioned, we're partnering with the AAMC. We have a call for submissions on climate and health in the MedEd portal. And we also have an open call in Frontiers in Public Health, which is more of a global publication that we're getting a lot of really interesting submissions for. This might be one of the last initiatives that I want to share with you is, if you haven't heard of it, it's called the Climate Resources for Health Education. So one of the barriers that we've been seeing again and again is that, getting faculty to have the support to do this education work is often difficult. So rather than each faculty member having to, reinvent the wheel, redesign a curriculum, make slides, do all that like hard work just to incorporate some climate and health content, what we did was we created, we created the Climate Resources for Health Education, which is really an initiative on behalf of now over 500 contributors who are faculty, their residents, their students. We created learning objectives and basically are pulling together teams to make evidence-based cases. Then they return the cases, and they're also making small problem-based, what are they called? Problem-based learning activities, and they send them back to us. We send them out for a peer review, an expert review. And so we have this process whereby all of our materials are evidence-based, they're peer-reviewed, and then they go up on the website, and they're kind of open access for anybody who wants to use them. So we are initially focusing on medical school education because that's where there was a lot of momentum building, but we're right now in an expansion phase where we will be incorporating an arm which is going to be focused on nursing education, as well as an arm focused on pharmacy education, and also an arm focused on incorporating One Health into health professional training. One other area that we're working pretty hard on right now is thinking about transdisciplinary research. So, this has really been an exciting, I would say even past 5 years with climate and health, just the amount of publications, the fact that the Journal of Climate and Health is launched and is live, we're seeing a lot more research engagement and starting to see the first signs that NIH might actually start funding this coming through. And so we have great knowledge, we have great research, but how do you translate that into policy action? And so with this initiative, what we are doing is bringing together teams from across the Americas to embark on research that engages from the outset, policy and decision makers, as well as academic researchers and clinicians. And these teams are getting together and they are developing a research proposal. We have 26 teams from 14 different countries, mostly in the Caribbean and Latin America, although we do have one team from the US. And we are providing seed funding for these groups to start their initial research and kind of taking them through the whole process of funding. So this is, a great initiative and a way to sort of think about building, the knowledge and the capacity within countries who are very vulnerable to this, to have their experts, their professionals, their ministries of health be the owners and the creators of knowledge to be able to help protect their populations. So we should be getting some really great research in the pipeline coming from this. So, thinking about kind of what our strategy has been, our domestic strategy is really thinking, at the level of schools, our goal is to have all health professional schools as members of the GCCHE. We really want to engage leadership. We want to get pledges from schools to say, okay, we're going to do this. I think there's definitely getting to the point where there's a little bit of, healthy competition around this, right? Columbia has a climate school now. Stanford has a climate school. That's great. There's some good, healthy competition there. And so we want to really think about how can we get everybody who wants to be involved with this. We're also working on how we can address issues related to national bodies who oversee the accreditation of health schools. So for example, thinking about the LCME, the ACGME, the Commission on Collegiate Nursing Education, the Council on Education for Public Health, again, trying to create inroads there, doing advocacy, but not quite advocacy, but sort of more along the lines of how can we work with you? How can we help you achieve your goals and really support their organizations who don't have experts in climate and health, right? And then we're thinking about licensure bodies, right? So for example, the NBME, right? How do we get climate and health onto the national boards so that there's that need to be teaching climate and health, right? We kind of need to work on kind of both sides of this. And similarly with the National Council of State Boards of Nursing, there's sort of this idea where, many schools teach the test, right? They want their students to do well. So we got to kind of play all the games that we need to in some ways, while we keep to our ideals, of course. I think another area where we're focused right now is thinking about specialty and subspecialty boards. So there's been some really great progress within the American Academy of Pediatrics. So they now have a continuance of certification module on climate and health. So this is something that pediatricians need to take in order to maintain their certification, which is fantastic. We're looking at how we can sort of use that model and apply to different specialties. We're also thinking about, how we can further engage national health associations, such as the AAMC, which actually this year, their November conference is having a special session on climate and health, which is fantastic. Also thinking about how to engage the NLN, the ANA, ASPPH, APHA, et cetera, et cetera. So in order to kind of think about how we can leverage, the clinicians and the health professionals who really want to be part of this, many are joining GCCHE as individuals, as institutions, as organizations. We have working group members. We have people who are signing up for our expert speaker lists because we often get requests from schools, can you recommend a speaker who could talk about this? So we have a list of people who would like to do that, as well as lists of mentors. The last thing I'd like to share sort of about our work is really the heart of this has really been driven by students. So we have a climate and health education fellowship every year. This year, we actually have 4 fellows. Natasha stood, she's in the middle. She was our first fellow last year. But every year we're going to have a nursing fellow. This year it's Gina Friel. We have a medical student fellow. This year it is Erica Strickler. We are taking we're sort of providing support for another fellow from the Colorado Climate and Health Science Policy Fellowship, and we have a public health fellow. So again, just kind of thinking about how students are really the driver behind this. So if this video will play, it will be amazing. I want to show you this video that was made by our students on Earth Day this last year. So let me know if you can hear this.
Dear health education leaders,
as a public health student,
as a pharmacy student,
as a dietetics student,
as a medical student,
as a nursing student,
as an epidemiologist in training,
I feel ill-equipped to prevent the health harms of climate change my patients and communities face.
In the recent months, climate change has fueled one of the most violent tropical storms ever faced by areas of my country that are usually spared.
Here in Richmond, Virginia, heat waves affect communities of color and low-income neighborhoods disproportionately, and yet I'm not taught what that means for their health.
The evidence is clear for more frequent and severe wildfires, to floods and droughts, poor air quality, and increased spread of infectious diseases. Climate change is the greatest threat to health that we face in the 21st century.
The COVID-19 pandemic has already highlighted the unprecedented strain that large-scale health crises place on health systems and healthcare workers.
And low-income communities of color, indigenous communities, will suffer the worst consequences.
A whole generation of nurses and nurse practitioners.
A whole generation of doctors.
A whole generation of pharmacists will have to care for those who suffer from the health harms of climate change.
Yet there's little formal acknowledgement of the coming climate catastrophe in our education.
But the solutions we need already exist.
The Global Consortium on Climate and Health Education has resources and frameworks for educating all health professionals.
Our health education encourages us to think deeply and collaboratively about the health problems we face.
And climate change is no different.
Educating us on the impacts of climate on organ systems, structural determinants of health, health policy, and health system science is an opportunity
to prepare us to face the challenges of a lifetime.
But we need your help to make it a reality.
We need your leadership to push for sweeping educational reform,
required to prepare a generation of healthcare providers to address the consequences of climate change.
If schools integrate the impacts of climate change on health into existing curricula,
then as an epidemiologist, I will be able to better understand the interaction of climate change with health risks and health outcomes.
As a physician, I will be able to talk with my patients about the impact climate change is having on them.
As a nurse, I will be able to provide heat action plan for my patients in a heat wave.
We, as health professional students, will spend the entirety of our careers working with patients and in communities increasingly impacted by climate change and environmental degradation.
With the proper training,
we can fulfill our duties as health professionals,
secure the health of our patients,
and achieve a more just society.
Oops. Okay. So thank you all for humoring that video. The students made it last spring, and I'm actually really amazed what they pulled together. I thought it was good. Anyway, my last sort of thing I'd love to share with you is our newly launched podcast called The Climate Clinic. This is being produced in collaboration with the Journal of Climate and Health. We have 4 podcast streams. The first one is Be the Change, where we talk about emerging climate and health solutions. The Code Red is where we're really covering sort of emerging, breaking climate and health realities. So for example, the flooding in Pakistan, we're doing interviews with physicians as well as community members in Pakistan. We have a short kind of sweet segment called Be the Expert, where you can kind of tune in once a week and get the 15-minute download on all the latest climate and health research. So for busy people, I think Be the Expert is where you want to go. And then our students have their own stream within the podcast called Code Green, where they kind of, they dictate the agenda, and it's really fun. So we welcome you to subscribe to this podcast. I'll put the link in the chat. And with that, I'll stop. And thank you all for your attention, and look forward to chatting. Oops.
Well, thank you so much. What a terrific amount of information and a terrific number of resources you shared in a short period of time. Particularly valuable, I think, is creating resources for education, curricular frameworks and slide sets and open sources that can help all of us do education better and more easily without, as you said, reinventing the wheel. So thank you for this body of work. It's really terrific. So we have a number of questions in the chat. I think first, very straightforward. Det Gerson wanted to know if anyone can access the toolkit that you mentioned early on. And I'm guessing that's at your website?
Yes, absolutely. It is on our website under General Resources. There's a tab that says Resources. You click on it, go to General, and you'll see it right there.
And I assume that that's true also for your curricular frameworks. And you mentioned the open source slide sets that many people had contributed to, all there at your website.
Yep, all there on the website. Absolutely. I'll put the website link in the chat right now. And
that's amazing. So another question for you, and Carl, I think I'll ask you to come off of mute and ask your questions.
Well, I had the impression that the toolkit was targeted towards public health and public health professionals, and you, the top of your pyramid of professionals were practicing physicians and others, professionals and changing the way they do things from day to day is actually not an easy task, because it's a system that just works every day, and it's very hard to incorporate new pieces into it, or new parts of the conversation, or new scripts in giving advice about diet or about what to do in certain kinds of circumstances. Is there a toolkit in making, or a toolkit available for primary care practitioners?
That's a great question. I wasn't sure where you were going to go with that. I was ready to give you the answer to one thing, but let me reorient.
I can ask something else.
No, that's a great question. Yeah, it's interesting. I think that, the content that we've prepared for medical students and residents actually is quite similar to where we would probably need to start with even practicing health professionals. Although I think they're a bit more savvy to sort of the system and what's possible. I don't have a framework for how to do that, because honestly, I'm not sure what the best approach is. And so I'd welcome sort of your thoughts on this. We have really, been putting on courses to sort of, that are all guided by our competencies to say, this is how you can apply this work to your practice. But, we have a really engaged group on our medical working group who are all family practice physicians who are really interested in trying to create that type of guidance, specifically for, family practice residency programs. But it's hard to get at practicing professionals, which is where I think, we need to be thinking about how to work with societies, because they're, it's like, I think once you leave residency, once you leave formal education, where do you get education? Well, the only person keeping you at task is your board. And many people belong to societies. So we've been working closely with the Med Society Consortium to think about how we can work together. And oftentimes what the gap is that societies don't feel like they have the expertise. Maybe they're just saying that they have members who do, but there's a lot of inertia to get over, as you can imagine. But I'm curious what your experience is.
Well, I'm a retired pediatrician, and the American Academy of Pediatrics has been somewhat of a leader in this area, I think. But what I'm thinking about is something that where pediatricians are concerned, I call climate-informed pediatric care, and it's blending climate messages into the standard guidance, anticipatory guidance that pediatricians give at well child visits. And it's one of the pushbacks that we would have from practicing pediatricians is that they already have so much on their plate that they're supposed to talk about in a well child visit. They have to talk about reading and gun control and all sorts of things, diet and exercise and so on. But each one of those items, or many of them, could have a climate message attached that doesn't make it, a visit have to last 10 minutes longer than it already does. But they need the script for that. They need to know, and they need to understand that it's best practice for them at this point. They need, the Academy of Pediatrics to say, this is what you do at a 6-month checkup. This is what you do at a 9-month checkup. And we need that, that content, and then the uptake by by professional societies, in my case, the Academy of Pediatrics.
Yeah, I totally agree with you. I think that it's got to come from society guidelines. And a lot of societies in Europe have moved on this, right? The Society for Cardiology in Europe, you know, they are now counting air pollution as a risk factor for cardiovascular disease, for hypertension, which it is, which we do not acknowledge as a potentially modifiable risk factor in the US. I don't know if you're aware of, or if you've ever met Andrew Lewandowski. He published a great—
in Wisconsin.
Yeah. So he published a paper recently kind of about that, you know, how do you incorporate this narrative into, you know, sort of daily practice as a pediatrician?
Right.
So thank you for the comment about the Europeans being perhaps a little bit ahead of us on that. That may be a place to look for some of that guidance in clinical practice. Okay, so thank you. Rebecca McKenzie has a couple of questions. Rebecca, do you want to unmute and ask your questions?
Sure. Thank you so much, Dr. Sorensen. This has been really very stimulating. I really appreciate your knowledge and sharing with us. So I have a question. I wasn't quite sure how to form it, but it's a question about our healthcare system right now isn't really a model of prevention. It's a model of, you know, take care of the illness or the damage after it's happened. And so I'm just wondering how that can be changed in your models of prevention, primary, secondary, and tertiary, to help not only, I think I'll incorporate my second question into it a little bit. You know, it's way past time for us to be acting aggressively on climate and health. And how do we turn this boat around? You know, carbon emissions continue to rise, and that means that impacts will continue to rise. So anyway, I'm just wondering about how we can pull together not only a prevention approach, but also mobilize other professional organizations to help really move the needle on this. Thank you.
Yeah, thank you. And I think that's a really great question. Maybe it's a little bit two-part in terms of thinking about, you know, how do we focus more on primary prevention? And I see it, you know, this has been a chronic problem, you know, for sort of all time, that we've really systematically defunded our public health system in the US. And I think COVID has this weird silver lining whereby people are like, oh, that's what public health does, right? Like, oh my gosh, we are totally don't have a public health system that can respond to these things. And so what's been coming through the pipeline? Oh, go ahead.
But at the same time, we've cut the public health system off at the knees. I mean, Dr. Fauci is such a good example of that. Like,
I know. Yeah, it's really tough. I totally agree with you. Maybe we're going to get some more funding for it. You know, maybe people are going to start realizing that we need to actually invest in our public health system, right? Because that is primary. And you know, I think that if we can move towards an evidence-based approach to public health, while simultaneously building the evidence base for what adaptation and mitigation actions really have the most bang for their buck, and apply them, you know, that's sort of, if we can do that, that is, I think, a sane approach to how we could move forward. All of this is if, you know, I think that, you know, among, you know, what can we do as individuals, right? I mean, we have like our spheres of influence, right? And we have a limited amount of time. We're all professionals. Like, what can you do? You know, I think we're all probably very outspoken because we're here, and we need to continue to be outspoken, right? We need to continue to bring this up at board meetings, at faculty meetings, at, you know, asking the question at open town halls. I mean, speaking about it, because, you know, as health professionals, we have this currency. We have trust of people in our communities. And I think we just need to keep using that voice. I feel like the messages are getting heard maybe more than they were in the past. So I think we mostly just have to stay optimistic. I don't think we're going to see changes overnight. I think we're going to see slow, gradual changes that happen too late. but that humanity will prevail. I don't know. I hope that, right? But I think we're going to be dealing with a lot of crises in the next 20 to 30 years. And we're going to be on the front lines of it. So we've got to be thinking on many levels here. And I think that raising awareness and education, and just so we at least have a common language to talk about what's happening, is maybe the first start. Yeah, thank you.
Thank you for that. Linda Martino has asked in the chat if you'll be doing more certification programs for educators. I think similar to the 16 session one you did.
Yeah, no, we are. We're actually about the spring. Well, we're having two workshops right now. One is on climate change and disability. We're working with a group that's a huge advocate for the disabled population. And so we're doing kind of a workshop series there. And then we're having a course right now, Climate and Health Advocacy Bootcamp, which we're doing in collaboration with the Med Society Consortium. We're only in week 2, so if you want to join, you can go to the website and join. It's totally free, like all our programs. This spring, we're going to have a course for Southeast Asia, which is going to be fantastic. And then we're launching a Pan-American course, which is really on health system strengthening and decarbonization. That will be happening this spring in collaboration with Health Canada, the US CDC, and PAHO. So that course will be coming this spring, and I'll be sure to make sure you guys get that information so you can register, and that will be a certificate course as well.
Awesome. And as I recall, that Climate and Health 101, or whatever the actual title was, is all posted. All the sessions are posted and accessible. So
yeah,
if you're not repeating that particular one, people can get the basic information there.
Yep, and we'll also be doing our 2-day, it's actually going to be a 3-day boot camp this year at the end of June. So if you kind of want to just come in and really get the download and have it, you know, with the experts and have all that discussion and that time for interaction, we have that 3-day boot camp, which is going to be open for registration probably in the next couple months, but we can also send you an update on that.
Be nice if it were at a summer camp where people could play outside in their free
I
time.
know. We've been sort of on this like virtual versus in person, and you know, always that struggle. But
I actually have a question for you. You mentioned that you're trying to get commitments from professional schools, medical schools, nursing schools, to integrate climate and health into their curricula, if I heard you correctly. What is the mechanism for engaging you and your colleagues in supporting efforts at our schools? We have a limited number of professional schools in New Hampshire, and we always like to think we can maybe reach everyone, you know, being a tiny state. So how do we go about that we have internal pressure? We're doing that at Geisel, at Dartmouth.
Fantastic. Yeah.
But we'd love to get the imprimatur of outsiders, and I'm sure the nursing schools and the pharmacy schools would like that as well.
Oh yeah, and actually Dartmouth is a member of the GCCHE, which is awesome. I can share with you who the contact was, and they, you know, they might have joined several years ago, right? And so sometimes you don't know, and this is what happens. You're like, I had no idea, but I will connect you because it's just great to kind of connect the dots there. Really, it's, you know, it's pretty informal. Basically what it takes is, you know, usually what happens is an interested faculty member will reach out to me, or I'll make contact with them, and we'll sort of have a conversation about it, develop a strategy, and then I'll provide a letter of invitation. And then it gets sent to the dean, and the dean says, this sounds great. And then we're able to proceed. So it's really, it's not binding. We don't ask for any money. Like, so it's kind of a little bit hard for deans to say no, but what we do find is that once you kind of engage leadership in that, sometimes, not always, but that can result in them wanting to appropriate resources for faculty to do the work. So we, for example, seen deans say, okay, well, the faculty comes to them, well, all right, well, then you're going to get 0.1 of your time to figure this out because we're committing to it, right? So I know that's kind of a big issue for faculty, is like getting the time to do this. It's time intensive. And so we think that we found that engaging leadership can be a way to get that like admin support to make things happen. So any interested faculty at any New Hampshire school can literally just send me a quick email. We'll set up, you know, a 15-minute chat, come up with a strategy. I'll write a letter addressed to their dean, and we kind of take it from there. So another way we've been doing this is we work very closely with the Planetary Health Report Card. as well as medical students for sustainable future. And, it's the students who go to the faculty, who go to the dean. And then, when students go to the dean and say, we think you should join this consortium, like deans can't say no to that, right? So we have a lot of strategies of arm twisting. Yes.
Really brilliant strategies, I would say. This is great. There was a comment from Mary Badger about the need to address osteopathic medical schools and organizations. And I'm wondering if you are, Mary, did I ask that correctly? Speak up if.
Yeah, the AOA and the ACOI, which is their College of Internists, seem to be kind of behind ACP and MD internal medicine groups in terms of climate change. So we just started a committee at the ACOI, in which case I'm in charge of it, and I'm having trouble drumming up interest to be on this committee. And also one of the sticklers seems to be that the osteopathic medical schools don't seem to be as much as the AMA schools. And so I'm just suggesting that whoever's in charge on your end might think about that. And if you want names of people to maybe get in contact with, I can put my email in here and I can send you stuff.
Yeah, that's a really interesting point, Mary. And I don't know, I'll have to look through and see if we have any colleges of osteopathic medicine, but I think, we need to get that happening in some way.
I know that we got the ACOI to join the medical consortium, but to my knowledge, AOA, which is kind of like the big group in charge of everything else that you have to go through to get med schools okay to teach these courses and stuff. So right now, I'm out in Washington State, and so they have a DO school here, and right now I'm just doing voluntary lectures as a retired internist. But it'd be nice if they could actually put it in their curriculum rather than doing their grand rounds voluntary stuff that the students.
Yeah. Thank you for that. Carl has put into the chat box that our next webinar, and I don't have the date, but Emily probably does, will be on the planetary health report card, which you just mentioned, Dr. Sorensen. So nice to be there. I see no more questions in the chat box, and it's time for us to wind up. No hands raised. So thank you for, again, terrific work. So helpful to all of us. Terrific presentation. And thank you all for being here and for a really rich and wonderful discussion. And
thank you so much.
Next time. And we hope